and we are joined here by the director and his colleagues. And I'm joined by Councilor Marty Nave, Councilor Peniawa, Councilor William, Councilor Monto, Councilor Joan Rouser, and Councilor Pat Hogan.
I was waiting at the door to be introduced.
Yeah. And what I like to see as you deliver this, Director, is I like to see the differences, you know, whether there's increase in budget and what percentage, you know, and stuff like that, and just talk through the logic of that increase and stuff like that. But let it unfold the success and, you know, where the funding have went in regards to those success.
Okay. So, all right. So we'll so just to kind of give it in a synopsis, and what I'll do is give you an overview, and then Anissa will give you the numbers. All right. So just an overview of what we've done this year so far. We've had the ARPA money, which we know that funding ran out in March this year. We will continue the DOJ, which is also Safer Streets, which will be completed later on this year. What we prepared today is just kind of tell you how we plan to move forward over the next year. So I'll let Anissa kind of give you a breakdown of what our budget is right now, and kind of like write out to give you out what we would be doing this year and where the increases are.
Good afternoon, everybody. Anissa Evans, Program Manager in the Mayor's Office to Reduce Gun Violence. So we're looking at page 70 in this book. And so we did some digging into these numbers. So FY25 was adopted. And just to run down that column, we saw that the overall budget was $265,676. And so we asked the question about when we look at the the projected number for FY25 and the proposed number for FY26, why the numbers have increased. And so what I was explaining is that the fringe benefits were not accounted for originally in the budget, so that's a portion of it. And so the adopted number went up because it's accounting for fringe for myself, Lateef, Allie, who was previously on board, and now Patrice. So that's where that increase comes from.
That's four staff total.
It is, four? But Allie, Patrice replaced Allie.
Oh, okay.
So essentially it's still 3. And then same thing for fiscal year 25 adopted versus the fiscal year 26 proposed. It's literally the same thing. They needed to account for salaries and budgets for all of us. And then in the overall budget for FY26, it includes the fringe that had not been previously added, $24,000 for the credible messengers within our office, but that money will actually be taken care of with funds from DCJS. There's $200,000 that we will allocate again to Unbelievable for trauma response. And then there's $96,684 that will cover Lateef's salary and fringe, and then $74,856 that'll cover my salary and fringe, and a portion of that will be covered by DOJ funds. And then when we look at Patrice, her numbers, from my understanding, are in here, but again, they'll be covered by the DOJ fund in full until at least April for her.
So you said the DOJ grant ended in March? When did it end?
ARPA ended in March.
Okay.
DOJ doesn't end until September. We'll be asking for an extension.
Okay. And initially, when all the staff was brought on, they were brought on under DOJ, right, grant, and then ARPA got in, right?
So ARPA covered more of the programming funding piece.
Okay.
DOJ covered programming and salary.
Okay, and salary.
Yes.
And so until September, right? DOJ is still covering salary until September.
It's actually covering through December for myself
Okay.
and April for Patrice, and then that funding will run out.
Okay, so far, it's still going strong, there's no need from the general fund. Where
Until
does-
those dates, yes.
Say that again?
Until December and April, correct.
Okay, and then it would, what happened? Do you apply for more, or what happened?
So it's two different funds. So DOJ funds programming, but then it also funds Patrice and Anissa. So after December, Anissa would go under the general fund after December. Patrice would go to April 2026, and that would be under the DOJ funding.
This is reflecting in the professional services.
Yeah.
No,
No.
Sorry.
Sorry,
Sorry.
profession-
Professional service. Yeah, you got it.
professional services is actually unbelievable.
Yeah.
The salary and fringe is actually under the contracted services related parties line.
Yeah.
Oh, I see. Sorry, missed that. Yeah, it's a zero line. Okay.
That's TRT.
Yeah,
Timothy
that's
Noble Jennings.
program.
So that's something that's been funded by the city for
Yep.
a while
Since
now.
Stephanie, right?
Yeah, since
Stephanie.
minor.
Yeah.
Mayor Minor. Yeah.
Any other question, Council, or you want to continue?
That's all I have unless anybody has questions.
Well, I don't know if the question was answered, that, once this funding goes away,
Then what?
So that's where we come in. So our main goal of the office is collaboration. So over the next year, that would change some. Now, we still have 3 individuals that work part-time for the city under Rachel May. That's a DCJS grant. Rachel May, this is her second year giving it to us. So 3 part-time. We would partner with SPD. We do what's called notification letters.
Are these credible messengers?
Yeah, they're credible
Okay.
messengers.
3
Yep.
of them.
3, yep. One is more so specializes in case management. The other 2, they focus on really mentoring, kind of continuing what we're doing. That kind of works with the DOJ grant, which is really outreach. So the individuals that work for the city, they work for individuals. They work with individuals one-on-one, along with that case manager, and including support from the staff here. Moving forward, we will continue to do the custom notification letters. So what the custom notification letters is when we'll get a list of individuals, core individuals from Syracuse Police. I would go out with a couple officers. Most of them we work with Frank Fowler, former police chief. We work with the Crime Analysis Center with GIVE. We go out to individuals' houses. We offer them a way out. So these are high-risk individuals. We would get their information, and then our outreach workers would continue to work with those individuals. That's one piece. The other piece is we have 3 different meetings that we have. 2 that we've started already. One is we meet as a coalition with county and city. That coalition is with the district attorney, the U.S. attorney, the mayor, Councilwoman Rashida Caldwell attends that meeting, and also the mayor, deputy mayor, and so forth. We meet every first Thursday. We talk about, we break down crime analysis of what's going on as far as crime, as far as gunshots and shots fired. And what it's really looking at is strategically planning. So when we all hear about the gun shooting if it's on the north side, how do we push out and make sure we're supporting that area as not just as an office, the mayor's office to reduce gun violence, but partnering with SPD and everyone else. Second meeting we meet with CBOs. Those are community organizations, Southwest Center, these different CBOs. We come in, we meet on the 3rd Thursday every month, and we coordinate efforts to continue to reduce gun violence. The last meeting we'll have that we're going to start is the faith-based meetings. So that will most likely start in June, Gun Violence Awareness Month, and that would be people from different faith, and we're looking at leaders. So we're looking at pastors, those who lead synagogues. We would meet with them at different locations along with SPD, along with the Crime Analysis Center, along with the GIVE coordinator, and kind of give a report out to the community and hear from community stakeholders on how we can continue to reduce gun violence. So that is an overall look of the next year of what our office will be doing, which is collaboration with community.
So with this 3 individuals that are being funded by Rachel May, how much is it?
50,000.
There's an initial 70,000, and then we just received another one for 50,000.
Okay.
So that's in the budget right now? They're
Yes.
negotiating the state budget now.
I'm sorry?
So that, I said they're negotiating that state budget right now, so that money's going to be coming to us?
Yes. Yes, we're working with Janet in research for the contract for that second piece, but the 70,000 has already been secured.
But that's not here.
I don't think it is reflected in here, no.
So which year is the 70?
It'll cover, 70, I believe, covered this year, 25, and then the 50 will help cover over the 26.
Okay.
How can it not be reflected?
Yes.
So the 50 would pay the 3 individuals, the incredible messengers?
Yeah.
Okay, and that's enough?
Yeah.
Okay.
Whatever it doesn't cover, I mean, once that, if Senator May doesn't, we go for more money or whatever, she doesn't give us money, we wouldn't have that position anymore. So our goal, hopefully, is that she would fund us again with the work that we've been doing.
So if it's not approved, then you will not have the position at the end.
Right. Right.
You work with other grants, so can you go together with other grants you do try to?
Yeah. So we've been working with research on other grants. A lot of grants won't allow municipalities to apply. So I think that's one of the biggest issues, that some grants, they want grassroots organizations to apply. But one that we are working on is with the SNUG component. So we are looking at going after the SNUG. They will not be contracting with Southwest Center again, the state, DCJS. So we, as a city, will be looking at applying for, when the RFP comes out, to take over SNUG. So that would be a big thing if we could get that. That's a budget of $1.8 million.
So the city is looking to pull it in?
Yeah.
And get run by us? So
Yeah.
they will be city employees, basically?
Yeah. And then that will be ran by my office, and we would, I think it would be, a better opportunity and a better organization through the city. Buffalo does it through Erie County Hospital, very successful. I've mentioned before, and I've said it, I'll say it again, the oversight. I think as a city, we have better capacity with oversight because you have an office that is focused on gun violence prevention. So, yeah.
So, Lateef, on page 70, the participants line where it says data not provided, the bottom of that page, is that the number of participants in the program?
Yeah, so I'm not sure. We can get that to you though. I can get you the number of signed participants.
Do you have a ballpark of, is the number a moving target throughout the year?
Yeah, so I mean, this was from the ARPA funding, so we should have a number.
So we were trying to get to 50. Was that the dream number?
And
Did we get to that 50?
Last time it was 13.
Not all signed. Signed those. It was more. This, and I want to be clear about something and correct something. It's more than 13. 13 is who is receiving therapy. We've signed more than 13 individuals. We've signed, and I don't want to give a number without being exact, but it's more than 13.
Okay.
Yeah, they've worked with more than 13 people over the last year. Definitely way more than 13.
So there's a staged type thing, they sign up, and then there's a stage where they go into Dr. Wright's program?
Yeah, so I do
Is
have.
Dr. Wright's program, where should her money come out of anyways?
Say that one more time. I'm sorry.
I said Dr. Wright?
Yeah.
Our mental health folk?
So that's not actually in here because it's coming out of the special objects, because it's still grant funded.
It's coming out of special objects.
Yes.
So it's still ARPA money?
I'm sorry?
I said it's the ARPA money we
Yes.
put in the special objects?
Yes.
So that means, I wish somebody from the administration was here, because I think there's a plan to take money out of, they're going to put that in SEDCO. Do we know anything about that? It'd be interesting to find out where that stream revenue is going to money to come from for Dr. Wright?
So, Latif, can I throw out a big picture question for you? And I'm going to reflect back to the first campaign I ever ran to try to get on the city council. You know, people would ask, you know, all of us up here, what are you going to do about violence in the city? And I don't know, right? It's a real, like, an intractable problem that we've had for a really long time. And I remember a couple interviews, one of the things that I did say was, I am glad that we have an office dedicated to addressing and thinking about gun violence. You know, I love the fact that we have people on our staff that are doing nothing but engaging with this topic. I know we can't do nothing. I mean, we as a city, as a community, need to try to address the issue of violence in our community. But do you believe this is the best model, the best pathway?
Yeah, 100%. I think strategic planning is number one, something that you don't see before this office started. You had no strategic planning. So you had organizations just they're doing the work, doing the good work, but there's no strategy to what they're doing. Number two, there's no data collection. So literally they're just giving numbers and I know who they're working with. Our office is just focused on that. The next thing is the collaboration with law enforcement. If you have no collaboration with law enforcement, you can't be successful at doing this. So as we meet just today, I met with law enforcement today about some things. That communication has to be there. And then the last thing I would say is you have to have this office to hold organizations accountable. What's been happening over the years, you give an organization $1 million and you don't know what they're doing with it. There's still shootings going on. So you have to have a data analyst to tell you how many shootings has happened. If you're working with certain individuals, are those individuals involved with shooting? Because have we seen over the year, yeah, where individuals in a program, been in a program for a year and commits a homicide. Does that mean the program didn't work? We won't know unless we have data or data to show what was happening. So I 100% believe what we do work. And I believe that moving forward, we will see more growth as we continue to go to conferences, as we continue to train individuals. Something I brought up when we met a couple weeks ago is the training component, which as our office, we will continue to do is training. All those trainings don't cost money. A lot of trainings are free through Project Rise. They have training all year. But holding these organizations accountable that they must attend the training. That's where our office come in. So when we look at it, you never had an office. So you had organizations working for the county, getting state funded, but they're working in the city of Syracuse, and the city of Syracuse never had a stake in the game. And not just talking about finances, but holding accountability. If you're going to do work in our city, we're going to hold you accountable. I don't care if you're contracted with the feds or with the state or the county. We have an office here in Syracuse, and if you're going to do the work in Syracuse, you're going to be accountable to what you're doing, and that's where our office comes in.
Yeah. So I think about what you presented a couple different ways. You know, one, I think about evidence of effort compared to evidence of impact. You know, if we want to talk in that language, if we want to talk about logic models, I talk about outputs and outcomes, right? You know, what are we doing compared to what are the outcomes that we're actually achieving, both short-term, mid-term, long-term. And, you know, I haven't engaged with your outcome data, but, you know, I'm willing to bet that you didn't get as far as you wanted to, right? You know, I think that regardless of where you're at, I'm sure you wanted to go further. Why not, and what changes have you been making to better realize the desired outcomes rather than to stay where we're at? And, you know, one of the potential explanations, you know, we talk about lagging indicators, you know, that there's a whole lot of effort that doesn't do a lot, then all of a sudden we see like a pretty big change. Yeah. You know, that could be one potential, but, you know, I think that there are other things that we need to think about to factor into the decision-making, the management of you and your team. What changes have we made when we didn't hit our targets?
Yeah, so I think let's look at the ARPA, use for example, because that's our main thing is we had $1 million in a year to work with 4 to 5 grassroots organizations in the community. When we look at those, so you had 2 or 3 grassroots, you had one large organization. what we found out with the pilot program is these organizations did not have the capacity that we thought they'd had. I think that individuals, organizations, they fill out an RFP to receive funding. And then after they receive the funding, you find out because you have an office that's totally focused on holding them accountable, you find out they can't do all they say they can do. So now the program gets delayed because they've hired individuals that aren't trained in this specific work. So what we've learned and what we've changed is that now we will have a training. Our plan as a city is to have an academy, a training, so that when another grant comes, or if we're not even funding them, if they're working for organization A, for them to work, they're going to have to go through an interview process, they're going to have to go through training, and they're going to have to be vetted. Those are the things that we learned from why, and I think we had some success, but what we could have been more successful if we had something in place. So let's just think about the police department. They have a interview process. They have a training, right? And then after the training, they do the specialized work that they do. Our plan is to do the same type of thing. There's an interview process. There's an academy for 6 weeks. And then after the academy, which would be helped run by Noble Jennings, so some of what he would be doing the training. He's been doing the work for 3 decades. Why we wouldn't use that expertise to make sure we have individuals that we're calling credible messengers are trained. Next thing we learned is that everyone's not a credible messenger just because they did 5 years in prison. What makes you a credible messenger is that you have lived experiences, that you have actually lived out some experiences and you made it through, and you're from maybe the same neighborhood as these guys. But that could be a teacher. That could be anyone, right? So those are some of the things we learned and that we would change over the next year as we move forward. And we would be, of course, if we're not contracted with an organization, we can't make them hire someone. But as a coalition and a collaborative saying, this is what we all agree upon, so that'd be the county when we meet the state, if they're funding these organizations, they would say, we're funding you in the city of Syracuse, but we need to make sure you go through the process of what the city of Syracuse is asking you to do. Otherwise, we can't fund your organization, so it has to be an agreement made there. So I would say that's what we learn in moving forward. The training, making sure we have some kind of academy and a collaborative effort by county, state, government to work together to continue to reduce gun violence. We have seen reductions. I'm sure you hear the reports of the numbers. I really have to give all respect to the police doing their job. But also you have who you don't see is those credible messengers, those guys that are, and it's not easy to capture what they do all the time. It's not easy to capture. Now we've done, and thank God we have a data analyst to give us some of that, but it's hard to capture everything they do because sometimes credible message doesn't understand that when you take a guy to a job interview and they're on that job interview for an hour and there's a shooting at the same time and that individual could have been at that shooting, that makes a big difference. That's not always a number that we can put on paper, right? But it's qualitative. And we've learned that too, that there's going to be more qualitative information that we can give you all more. And as we will have a whole report on the $1 million of ARPA. But in that, you're going to see a lot of qualitative data on top of the quantitative data.
I just want to remind us, I'm sorry, I just want to remind us we have like 5 minutes left.
Sorry.
And we want to make sure CRB is next. And any other pressing question, councilors? Latif, any last comments? Anisha, last comment? You good?
We are unique.
Yeah.
Not many communities have this program.
Yeah.
It's a unique program.
And just so you know, we're getting calls from Buffalo, Rochester. I'm doing a presentation for Buffalo, the city of Buffalo. I'm doing presentation for the city of Boston. I've been to Boston last June to speak to them about what we're doing here. So we are doing something unique and not being done everywhere else. So we just want to continue to do the work.
So speaking of impact, to Councilor Williams' point earlier, what we're, because well, to your point that the whole process is to make sure that we we pull these individuals off the street, so if there's shooting, that they are not part of that shooting. And part of keeping them busy and out of the way is what we had put in as workforce development. How many workforce development,
So out of the 50 or just overall?
just overall, that you have put through workforce development?
I don't have an exact number, but I know it's over 20 people. So every individual, and just so you know, they reached out to all 50, but a lot of them, and last thing I'll say, you know I'm a pastor, counsel, so I can go long-winded, but I'll try to shorten it. A lot of the individuals would not sign on, but they wanted to work because they just didn't trust not just the city, just any form of government. They didn't want to sign. So all 50 were all contacted. So out of the 50, even though if an individual didn't sign, they still helped them with workforce development. So I would say more than half of the individuals either were on a job or got into some kind of programming through CNY Works. And I do think we have to continue that, giving them something else to do. So that if it's over half of 50 that are now involved with either workforce development or school, that's half of 50 that aren't shooting. And remember, we're talking about high-risk individuals. We're not talking about the bad kid that don't go to school. We're talking about high risk.
So in the case management side, is there a way you can demonstrate, through the workforce development placement, can you demonstrate to us what companies have taken these individuals in?
Yeah.
We don't need name, but just so that we see the impact.
Yes.
Okay.
So Upstate, of course, they were hired by Upstate. The Carpenters Union, we have a couple individuals that's going through the process through CNY Works to get on with the Carpenters Union. We also have seen individuals get hired by moving companies just to get started. And some of what we've done, we've been strategic about. So if you get an individual off the streets, the next step might not be applying for DPW, but just getting them a job at a moving company. So we did, and I would say 5 or 6 individuals were working for a moving company or still working for the moving company. Like I said, the contract ended in March, so I can't tell you what they're doing right now. But as of end of March, they were working for either moving companies, going to CNY Works, continue looking for a job, and we got individuals working at Upstate. And I can give you more information as we reach out to the organizations that work with them to give you that number.
That would be great. Any other questions? All right, let's take the next 2 minutes to maybe stretch a little bit because we've been sitting here, and CRB is next.